I think as a doctor, you know that there's something there that would work and be effective, and to see somebody unnecessarily suffering it sort of goes against like everything you've been trained to do. I've quite a few younger teenage girls who've had to opt for pills that really don't suit them. Sometimes they've had to be referred for a different type of contraception because there's a pill that I know would be available in the UK that would be perfect, but it doesn't exist here. I have women who've not been able to continue to afford their HRT, MHT, and have had to opt to go on to a PBS subsidised anti-anxiety medication, which really doesn't treat the cause and doesn't really treat their symptoms adequately, but it's all that they can afford. That to me is totally crazy. These are drugs that we don't like to prescribe as doctors. They have risks. You can develop dependence on them. The majority of my consultations are women's health, and the cost of either HRT, MHT or the contraceptive pill is always an issue. I have very few patients who are not interested in the cost, and I work in an affluent area, so I expect that colleagues that work in other areas would be having that conversation in every single interaction with females when it's about contraception or MHT.